Dog's murmur is an early diastolic murmur heard in coronary artery stenosis. Initial documentation was in a man with heart failure due to hypertension and left ventricular aneurysm. The diastolic murmur was recorded in a sharply localized area only when he was in the erect posture. This high-pitched murmur was thought to be from a stenotic left anterior descending coronary artery, which was suspected to have recanalized thrombus. Sangster and colleagues reported 3 cases with coronary stenosis and diastolic murmur. The murmur was heard in the third left intercostal space in a small area about 4 cm from the mid-sternal line. Phonocardiogram documented a crescendo-decrescendo early diastolic murmur. In their first case, a diastolic thrill was felt over the LAD during bypass graft surgery. The murmur disappeared when the artery was fully occluded in another case. Angiography had demonstrated the absence of aortic regurgitation in these cases. Similar murmur with echocardiographic demonstration of LAD stenosis has been reported. Echocardiography was also useful in ruling out aortic regurgitation as a cause of the murmur. In another interesting case, a diastolic murmur of coronary artery stenosis disappeared immediately after aortocoronary bypass surgery. 2 months later, the murmur reappeared when she had acute anteroseptal myocardial infarction, presumed to be due to occlusion of the bypass graft. Coronary angiography 10 months after the surgery showed occlusion of the bypass graft, but the murmur was no longer heard. In yet another report, 2 patients had diastolic murmur caused by coronary artery stenosis. Both cases were associated with severe localized narrowing of proximal LAD demonstrated by angiography. The murmur disappeared after acute myocardial infarction involving the area supplied by the stenosed artery. Intermittent diastolic murmur caused by coronary artery stenosis has also been documented. Here are the first set of journal references on dog's murmur. Second set of references on dog's murmur.